There's a new warning about hackers targeting hospitals and healthcare systems. Cybersecurity firm Mandiant tells CBS News they are specifically worried about the group Fin12. They say 20% of their victims are healthcare systems or hospitals. CBS News senior investigative correspondent Catherine Herridge discussed the findings in an exclusive interview with Kevin Mandia. He is the founder of network security company Mandiant, which released the report. Catherine Herridge joins us now with more. Hi, Catherine. So what are we learning about this new hacking group and who's behind it?
Well, Tanya, this group is so aggressive and ruthless in cyberspace and have been ramping up their attacks specifically on healthcare networks that Mandiant came out with a report, and they publicly gave them this name, Fin12. And what also separates them from other ransomware groups is that they're essentially going in quick and locking up data. They're not extracting the data to then extort these clients in the future. Here's how he explained it. What is Fin12?
Over 20% of the ransomware attacks that we respond to as a company is Fin12. And when you respond to somebody that frequently, like a detective, you start knowing their fingerprints, their tradecraft. And we need to communicate that tradecraft to the world, because Fin12 is very good at extorting companies via ransomware. They're efficient, they deploy it, they're not easy to detect till you already have the problem, and we want to change the battlefield to us starting to beat them, not the other way around. They're making millions of dollars, and they're taking advantage of a lot of different American companies.
And this group is so mysterious, they couldn't tell us who they think exactly is behind it, but they do know, and they've confirmed, that these are Russian-speaking hackers. And while they primarily target America, they are starting to go more global. But it's really worth noting, Tanya, that the one country and area they do not target is Russia and those former East Bloc countries.
That is notable. And Catherine, how real is the threat to healthcare networks, and what can they shut down? Is there a danger to patients specifically?
I went into this story, and that was my primary question. Is it a hypothetical threat, or is it a real threat? And we did some secondary reporting, a follow-on to that interview, and what we heard from research firms who have been auditing healthcare networks, that they have seen instances where vital services have been shut down. So think about things like heart monitoring devices or patient records, or the ability to communicate in real time within the hospital. Let's listen to that exchange. These hackers aggressively going after healthcare networks.
20% of the victims were healthcare. And I remember reading other ransomware groups saying, we're going to go hands off. We're not going to hit healthcare or hospitals, because that's infrastructure that, quite frankly, we rely on for the health and well-being of our citizens. They are targeting, meaning Fin12's targeting is why we're going public. We want to do an announcement to make sure hospitals can defend themselves and healthcare can defend themselves.
So these are hackers with no conscience during COVID.
Well, I think it's hackers that want to make a lot of money, and their desire to make money is currently trumping their desire to do the right thing.
The other data point that we found, frankly, really disturbing, is that when they launch these ransomware attacks, they do it on healthcare networks, not fully understanding what kind of systems they will cripple. They do it primarily because these are high-revenue operations, and they simply cannot afford to have these systems shut down, so they are highly likely to pay very high ransoms in a very short period of time, Tanya.
Scary stuff. Catherine Herridge, thank you so much for sharing your
welcome.
Excellent reporting with us. We appreciate it. And you can watch more clips of Catherine's interview online and see the full report tonight on CBS Evening News with Norah O'Donnell.